Speaking of predictability, an unpredictable subject at this point for at least us in the media trying to cover it is healthcare, and healthcare reform is another big topic in Washington. Seems to be getting a little bit more tread in the Senate at this point in time, but I know the House has to be working on it too as a whole. Where do you see the timing necessarily in the House coming on dealing with healthcare reform? Because, for instance, you guys have climate change and energy off of your plate right now, so you can turn to some other issues.
Right. Well, let me tell you what I think happened. I referred to the Congressional Budget Office as being the unbiased analyst for Democrat or Republican for the Congress. And they came out with this estimate on the climate change bill, that the bill as it was written by 2020 would only have an impact of $175 per year on each American household, and that on average, and that doesn't include what I pointed out, the potential increased efficiencies. Well, they were asked to do an analysis. I think it was on a Senate bill. I forget whose proposal it was, but they had the kind of the basic framework of this bill. Analyze this for us. And again, they approached it with the confidence that we give them, on how do you analyze bills. And they came back with an estimate. I think it was between 1.2 and 1.7 trillion dollars over 10 years. And at the end of that 10 years, we would still have 36 to 37 million Americans uninsured. Well, if I believe they're 175 on the climate change bill, I gotta believe they're 1.2, 1.4 trillion dollars over 10 years on the health care bill. And I have compared it to that scene in the first movie, Rocky, where he's in the cold storage hitting the slabs of beef hanging down there. That was like a body blow for those of us who care about this issue, because nobody expected their cost estimate to be that high. So the train is not derailed, but the train is clearly slowed down because the costs have to be addressed. When we do things like, a war in Afghanistan to get rid of the Taliban and Al-Qaeda, we don't sit around and say, well, we really got to figure out how to pay for that before we declare war. No, we had to get rid of the Taliban. We'll figure out how to pay for it later. When you're undertaking a dramatic change in how we administer health care in this country, and you already have an early warning sign, this cost is going to be a problem, you've got to stop right then and sort that out. And that's what's going on now. I know that the Senate is looking at it. Senator Lincoln is in the middle of that. I talked to her yesterday about it, and they're trying to sort through, exactly what kinds of savings do we think we can find, real savings, not just kind of made up stuff, because we don't want 10 and 15, 20 and 25 years to go by and people look back and say, well, that was shoddy work, and we're stuck with a big bill. So I'm still optimistic that health care will be done this calendar year. But if you'd asked me, if you'd had me here 3 months ago, I would have said, maybe the next few months. I don't think that's going to happen now just because of the timing of everything else in the middle of summer.
What are a couple of concrete principles or bedrocks of healthcare reform that you feel have to be addressed? What are some things that cannot go unattended?
Oh, I think there's several things that we have to look at. First of all, we have talked a lot. Bill Clinton talked about the 41 or 42 million uninsured people. That number is close to 50 million now, probably 47, 48 million. I mean, we clearly have to come up with something that addresses that issue in a fairly major way, so that we, for a lot of reasons. But anyway, so we need to address that issue. We need to have a sense of predictability of costs. Small business people need to know and have some predictability that under whatever system we come up with, that they can look years down the line and have some reliable estimate of what that cost is going to be for them as a business. I say small business because they're the ones that have had the most difficulty in this. So predictability of cost, efficiency of administration of health care. Our stimulus bill didn't get much attention for its health information technology, but we have made a substantial amount of money available. By the way, that would make a good show with some of your people here if you haven't done that, because there is a substantial amount of money available for hospitals and providers to help them, not pay for it, but to help them with the investment that it takes to dramatically change an office. The people who have the most problems are the small doctors' offices. Big entities taking care of it. But if you're one or two or three or four doctors, it is a terrible inefficiency for several months while you're trying to buy the new system and get up to speed. So we need to have a much more efficient system in terms of health IT, health information technology, because that will help ultimately save money, eliminate duplication of services, cut down on accidents. too many drugs. You know, an older person, I say an older person because I make mistakes now with my drug, taking two of the same kind of thing because one doctor didn't know the other one had prescribed something. All that kind of savings can come. So those are some of the things. Let's see, what else? We have got to have groups big enough so that some small business person doesn't get hammered because one of their employees went and found out she had breast cancer, and it throws the whole group off. There's got to be predictability. And we also have to address this issue of people being denied coverage or getting coverage, but, okay, because you had this heart condition 5 years ago, we're not going to cover your heart. Those are kind of the very obvious gaps that we all know we have, and we need to get rid of those.
Walmart came out this week in conjunction with some other groups and made a pretty bold statement that they support a couple of different areas of reform, but the biggest one that got attention was employer-mandated health insurance. Is that a game changer, do you think?
I think that's one of the things that's in the mix. By the way, Walmart has been an advocate for several years now about the need to do something, and what has given them credibility is they have done a dog and pony show with the Service Employees International Union. They travel around together. In fact, I sponsored one of their forums for House members where they had each of them brought representatives. So when you have a labor union and Walmart who don't always agree on a lot of things, but for several years saying we have to address health care in a major way because it holds all of us back, it hurts us in our competition internationally, hurts small business, hurts providers of health care, hurts patients. I mean, they have made a strong case. With regard to mandates, I think you're going to have there's going to have to be mandates in the bill. You and I are not shocked that we are required to have insurance when we drive a car. Our system right now is one which is if a person is uninsured, decides to go bungee jumping and cuts the line halfway down, our healthcare system will take care of them the best way it can, and they probably won't be able to pay any bill. We're going to have to somehow have a mandate in there. I don't know if an employer mandate or an individual mandate is the way to go, but we've got to see that as much as possible everyone participates in the system because they already participate in the system on receiving health care. You and I walk out of your studio here, and there's somebody laying on that lawn. We're going to see if they get health care. We're not going to check their wallet to see if they've got an insurance card.
We're running short on time. A couple of yes/no questions for you, all right?
No. I guess that's a wrap.
Oh, good try. Are you running for re-election next year?
Yeah, I'm running for election.
Are you planning on having any more kids?
Not planning on having any more children. No.
So there's not going to be a Vic and Betsy +8 show in the making?
No. There has been some people talk about that, and I say, can you imagine trying to get an approval for a reality TV show through the House Ethics Committee? I mean, that ought to be the reality show, is how could you get a reality TV show approved by the House Ethics Committee?